a topical corticosteroid, maybe some antifungals, and maybe even for the regular oral contraceptives that the women take. Given that adequate information, they are unwilling to submit to the inconvenience, like I said earlier, of visiting a doctor for what they feel or they rightly feel that they can manage for themselves. You understand? So if you have adequate information about your diagnosis, then you feel if it reoccurs or if it's something that's chronic, you think that you have enough information to treat yourself. Okay? And so you don't need to go and waste time, in quotes, to go and sit in the doctor's office. But you might want to say that is good or bad, but you would have to decide. But I think that's bad. I think that it's important that you, irrespective of the information that you have, whether you go online, whether somebody else told you, but it's also important to speak with your physician, your pharmacist, if you have no access to the physician at the point in time, because we all function. Our body functions differently.
Even doctors go to doctors.
So I was talking about the skin, and that is one of the potential risks on individual levels for incorrect self-diagnosing. And we want to look at maybe a typical fungi or eczema on the skin. The problem arises because there are several dermatological conditions that have the same or similar manifestation. They all look alike. They all manifest with the itching, the redness, and maybe a little dark spot, a gray spot, whatever. But a lot of them manifest the same way. But the treatment for each one is different. There are even cases where the treatment for one condition can actually worsen a different condition. Okay? So thus, the correct diagnosis of that condition is of paramount importance.
You need a professional. Because not even the pharmacist can watch with their naked eye and tell you that. You need the expert, somebody who specializes in that area. Sometimes even the dermatologists have an issue or trying to figure out what exactly it is. So now at this point they have to do a swab, send it to the lab, and based on the organism that's causing that infection, then we can treat it, because we might treat it with drug A, and drug A could worsen that condition because it's not sensitive for that. It's not a fungi, it's not a bacteria, so you have to know which one it is so that you can treat it accordingly. Often unknown to the user, the medication contains steroid, which need to be specifically tapered. The steroids are something you don't stop abruptly, or you don't start with high doses or low doses. You have to know what the condition is so the doctor can decide, okay, if I'm starting with 10 milligrams or 20 milligrams or 3 milligrams, whatever, but we taper in it. Either taper in it down or we taper in it up. If it is abruptly stopped, it can result in adverse effects and withdrawal symptoms. Yes. If the condition did not require steroids in the first place and you took something off the shelf for that, then, and you might not even know.
And you don't even know that. Then the body has been weakened and it could go through unnecessary stress. You may not feel it, but the body itself is going through that stress for no reason. One must also consider that if the medicine or the dosage is incorrect, then like any other drug, there can be adverse effects or lethal.
Lethal too.
Lethal drug reactions.
You can take more than necessary or less than you need.
Yes, and we're still talking about your skin. I'm not talking about anything I'm taking else on the inside. I'm still talking about the skin.
So a skin problem, if not treated properly, can be lethal?
Oh yes, for the same reason I just said, that all these dermatological conditions, they have so many similar manifestations. So you don't know what it is. You might call it an eczema. It's not an eczema. It could be psoriasis. It could be skin cancer. They all have so many similar manifestations. So the fact that a doctor or a doctor who specializes in the skin, dermatologist, would be the better bet. You can also visit with your pharmacist. Your pharmacist can have an idea by looking at it and asking you questions, ruling out things. We can possibly say, okay, this is probably what it is. Let's do that. If this doesn't work, then you will have to find the doctor, or maybe even send you to the doctor if there's no way we figure out what it is. So it's important that you do that. The superficial fungal infections resulting in like common things like itching, they're easily managed. You might get an antihistamine for the itch, to stop the itch. They can be controlled and cured with time. Cheap and safe antifungal agents. On the other hand, many creams required for different ailments may contain topical steroids, what I just said earlier on. If applied wrongfully, due to the self-medication, the inflammation is suppressed, but the fungal organisms, they are not eliminated.
Still there.
It is still there. So one might get temporary relief from the itching, but the infection persists and will erupt later in a bigger way. Okay? By the time the patient goes to the dermatologist or the doctor, the morphology, what we call the appearance
of that condition on the skin would have changed, thus making the diagnosis tricky, like what I was trying to just
difficult.
Exactly. The patient will be asked to stop all medications, creams for at least a week so that the accurate diagnosis can be made by the doctor. Treatment too is more complicated now. The treatment for this condition is more complicated now because we have created something different from what was there, as the fungal organism could have by now developed resistance to the time-tested, cheap and safe antifungal preparation. So right now we may have to get something so much more expensive than what you would
normally take.
Exactly. So now we have to go to the doctor, you have to pay the doctor's fee. Secondly, you have to get a treatment which is more expensive than the cheap one that you could have used at the beginning. It is going to be more costly to, for what you try avoiding by self-medicating. Yes, by self-medicating yourself. The doctors are now forced to use newer, costlier and more potential antifungal agents that may have more potential side effects. And as the corticosteroids go up in strength, the effects are even greater.
Side effects.
Yes. So with having to do that, then we might see more potential for those kind of side effects. So some medicines may contain different, they have different strength in the corticosteroid. Prolonged use can lead to things like white patching, thinning of the skin, redness, pimple-like eruptions on the face or the other parts of the body. And patients may become even addicted to these medications because of what they do. Because some of them, they lighten the skin. People like that. So they might get addicted to wanting to use it, keep using it and using it all the time. And so if they have to abruptly withdraw from that because of the skin condition, then as I said earlier on, we have the possibility of the withdrawals, symptoms that we don't want. And it could be some kind of flaring up on our bodies that we don't like. You understand? So this is very important that we do that.
Okay, ladies and gentlemen, we're focusing on the skin today as we're talking about self-medicating. And of course, from what you've heard so far, you'd realize that, yes, it's easy to do sometimes. You have more time to go to the doctor, or you do not want to go to the doctor or pharmacist for several reasons. But the fact is, they are the professionals. And invariably, they get it right. And, of course, the ordinary person, we haven't got the necessary training. We think we know it all sometimes, but, of course, that can be very, very dangerous. We continue talking about self-medicating and, of course, back to Martha.
Yes, so some of the potential risks on, again, the individual level, I just used the skin here as an example. I just elaborated a little bit more on it, but some of the potential risks would be failure to seek the appropriate medical advice promptly, the incorrect choice therapy. You use the wrong stuff for what it is that you have because you don't know what it is. Failure to recognize special pharmacological risk. You don't understand what the drug is. You have no idea what the side effects or the risk of using that.
If you have a side effect, you don't know how to deal with it.
You don't even know how to deal with it because you cannot recognize it because you're not trained in that area. Rare but severe adverse effects might happen because we have different levels of the side effects as the drug increases or according to the individual, whether it's a child or an adult, elderly, female, male, whatever the situation may be, and even the point of application. So all of that, we can have some severe adverse effects. Failure to recognize or self-diagnose the contraindications of that drug, the interactions, the warnings, and the precautions, all of that. You're clueless about it.
Yeah, you
might just know the drug,
the medication and not even looking and reading what is written on it.
Yes, but sometimes you read it and you don't even understand it because we're talking about contraindications, we're talking about interactions, we're talking about warnings, we're talking about precautions. What are all of those?
No,
so you have to
take that with something else, the other medication that's prescribed that you are taking, how it can affect you.
So all of those things you have to be mindful of. Failure to recognize that the same active substance is already being taken under a different name. You could be using something that you're already using and not even sure about it because
you're doubling the dose.
Exactly. And for there, I must pause and give something that I know that happened recently with a patient who had what we call a strep throat, a sore throat. The flu was going around and had taken her kids to the doctor. They gave the kids a few of the capsules, penicillins to take. And that for the same reason, she felt that she had a meeting that afternoon and she was quite busy. She didn't want to go to the doctor. She just figured, well, maybe I can medicate myself. So she went into the cabinet drawer. She still had some of the penicillins, which should not be there.
No.
As long as the 7 days, whatever, how many days pass,
if you
whatever is left, you throw it.
As you're supposed to take it.
If you
there should be none left.
Yes, even if you did not take it and it's there, throw it away. It shouldn't be there. So she went and she took a couple, she's self-medicating. And in no time, she collapsed on the floor.
Oh, my goodness.
She collapsed. She had an acute allergic reaction, difficulty in breathing. Thankfully, somebody was home, so they were able to call the ambulance. They came and they were able to resuscitate her. So after investigation, the blood test, they realized that she had a penicillin reaction. So they said, penicillin, I'm not even aware. Penicillin, the only drug I know that I'm allergic to is a drug, calvucin. So the doctor told her, well, what did he say? She said, well, that's exactly what it is. This is a group of penicillin. It does contain amoxicillin in it. Okay, but you don't know that.
You're not a pharmacist.
So if you had known that, you would not have taken the penicillin, because the penicillin and that drug, they're the same drug with different names. But in the first place, it should not be in the cabinet if you're done with the treatment course. You understand? Because that's a question I ask. Why do you still have it? Why do you still have 6 capsules left?
Because you didn't take it properly.
And 6 capsules is not going to help you.
No.
And the 6 capsules, in the first place, they were not prescribed for you.
But isn't that ironic that people would think that you go to a doctor, they give you medication for a child, for example, in that case, and then you're supposed to take 24, you take 18, and you'd think that the 6 can help cure another issue.
Yeah, imagine.
That making sense?
Yeah, it makes absolutely no sense. So this is important that we know that. I think we overlook those things. Cannot think beyond that.
This is not our line.
Well, that's what it is. If you're not trained in a certain matter,
to the pharmacist
all the time, because if you're not trained in that way, then you're not going to see it. You're not going to see beyond it.
That person might be very, very good, a good constructor, or maybe in some other skill, some other.
Oh yes,
you can see that person.
But that's I'm telling you, my friends, people I know that especially in electronical field.
Oh my goodness.
I'm totally lost. I'm like totally lost.
You left to more.
Yes.
You don't know anything.
And they find
children know more than you.
That's my point. And they find that they're lost when they come in the pharmacy and they see so many drugs. And like, how do you know that? How do you know this? So you have a trained eye for that. You have a trained ear for that. So let the people that are trained deal with it. Listen. And don't go on the internet and just take in information, because it is not always.
Information can be dangerous.
Too much information if you don't know how to use it properly. Yes, that's right. So we want to say that failure to report your current self-medication to your prescribing physician is important. So if your doctor is prescribing something to you, let your doctor know what it is that you're currently taking. Double medication is a harmful interaction. Failure to recognize or report the adverse drug reactions that you've gotten before from certain drugs that you've taken. Incorrect route of administration. We spoke about that before. Instead of taking it by the anus, you would use it by the mouth. That's an incorrect dose. Risk of dependency, food and drug interactions, and your incorrect storage of your medication. All of that is important. And these are the potential risks that can develop from self-medication.
Wow. Man, that was a mouthful, and so much we learned today.
Yeah, there's so much more.
Yes,
where that is concerned.
You can see the importance of not medicating yourself. Ou pas un docteur, ou pas un monde qui connaît le concept cela, ou pas étudier médecine.
Right.
So leave it to the professionals.
That's right.
And time went by so quickly. Martha, thank you very much for talking to us, sharing with us again on tablets and spoonfuls. The number to call, as we always say, is 440-8600. And of course, we will see you next week. In the meantime, take care of yourself. The whole idea is to manage your medication at home properly, effectively. And of course, self-medicating is a danger.
Self-medicating is self-destructing.
Self-medicating is self-destructing. Can be self-destructing.
Yes.
There are times when
can lead to self-destruction.
Right, because there are times when you can medicate when
yes.
Yes. You should have your basic things at home.
But it can lead to that for the same reasons we said, if you're not sure about what you're doing.
All right. So till next week on another program, I'm